Now the next presentation is by Dr. Pratibha Kataria on clinical and MRI analysis in myopic anisometropia.
Good morning everyone. Myself Pratibha Kataria and I am a project SRF in one of the projects funded by SERB. So my topic for presentation is clinical and
Speak a little loudly, doctor.
My topic for presentation is clinical and magnetic resonance imaging analysis in myopic anisometropia. We have grant support from Scientific and Engineering Research Board, which is now known as Anusandhan National Research Foundation, ANRF. My co-authors are Dr. Zia Chaudhary, Yashwant Singh, Manavdeep Singh, Prabhas Shekhar Mishra. I will be discussing about myopic anisometropia, which is characterized by asymmetrical myopic refractive error in the eyes of the same individual. There is no unifying postulate that explains how and why two eyes within the same environment and identical genetic influences develop asymmetrically and produce different refractive errors, sometimes leading to amblyopia and loss of binocularity. This unique pilot study analyzed extraocular muscles, characteristics of the less myopic globe acting as an intrinsic control for the more myopic globe in subjects with non-strabismus myopic anisometropia of 3 diopter or more by high resolution fast spin echo T2 weighted surface coil orbital magnetic resonance imaging 3T Siemens Skyra. So we used the methods and we analyzed 13 subjects of average age about 20 with anisomyopia with the subject fixating at the center target. 2 mm thick contiguous quasi-coronal images planes were used and they were analyzed for extraocular muscle pulley locations, cross-section and LRSR band length, while quasi-sagittal and axial planes were used to measure rectus, eoma and optic nerve length, all by ImageJ software as per the published norms given by SERB. A comprehensive ophthalmic evaluation was performed in all subjects and clinico-radiological correlation was performed. So we found that when we analyzed all the parameters, we found that there is a marked defacement and lengthening of the LRSR band in more myopic eye versus the less myopic eye. And the average refractive error in the more myopic eyes was also more in more myopic eye than the less myopic eye. But other parameters like rectus extraocular muscles, length and pulley positions as well as optic nerve length, they were all similar, they were not significantly different. We analyzed and we calculated all the parameters and this table shows that we have found the significant difference only in LRSR band length and refractive error but not the other parameters. So these pictures show the right eye which is more myopic than the left eye, shows eyeball elongation is a conical form in the right eye which is more myopic on axial scan. If we see the sagittal scan, this also shows the conical formation of globe. And in the quasi-coronal scan, you can see the more LRSR band attenuation. And
can you show it to us with the pointer and the mouse?
1 second. Can you see this LRSR band is little longer than this one, which is in the left eye. And here you can see the larger eyeball in the more myopic eye than this one, the less myopic eye. These results we found while we analyzed all the subjects. And similarly, our conclusion is this, that in all the subjects we found the difference in the LRSR band and refractive error, but other parameters were more or less similar in all the subjects. And I am also analyzing other subjects also. Our analysis are going on. So we will further conclude when our subjects will be done. And thank you.
Good, very nice, very interesting. Thank you very much. Anybody has any questions from the audience? Okay, thank you, doctor.
Ma'am, if we see that myopic anisometropia, already we know that in a same individual, if both the two eyes grow differently, even in the same environmental and genetic influences. Why this happens? So we are just dealing with these things. We are finding why these things happen. Like two eyes, how they can grow asymmetrically. Yeah. Yes. Yes, ma'am. Yes.